Now, hundreds of nurses are gathered at Providence St. Vincent picketing for better working conditions and better pay.
Yeah, it all comes as their contract with the hospital has been up for weeks now. Let's get right out to Fox 12's KANDRA Kent, who is live there with more. KANDRA?
You can see the picket behind me. This is a huge gathering in the last hour since we've been here. I would say at least a few hundred more people have shown up. You can see them carrying their signs here. They're on our side and across over by the hospital there. And nurses say they hope by picketing here tonight, it will help them gather the support they need to improve their work environment and patient care. Meanwhile, hospital officials say this sort of event is just a distraction, one they say is disappointing when the union will not make a greater effort to come to the bargaining table. With their contracts expired for weeks now, St. Vincent nurses and the Oregon Nurses Association are looking to up the ante during labor negotiations with the hospital, drawing more attention to their demands by picketing outside the hospital Monday evening.
We would like to provide the community the best health care we can possibly do it, and we need Providence to work with us to provide those tools.
Among the top of their wish list, specific nurse staffing levels spelled out in the contract. ONA says after 2 years of the pandemic, nurses are beyond tired of being stretched thin.
We see what happens to the community when they can't access care.
Registered nurse Heidi Swaney says she sees the effect on a daily basis as a telenurse who triages patients.
If we don't have adequate staffing, we can't answer those calls in a timely manner. And that's where we get very concerned and what we're trying to bring attention to. And as a nurse, that really does weigh on us. You talk about burnout and stress. Knowing that we're not helping the patients in the best possible way, that's one of our biggest burdens.
Other demands include improving patient safety standards, better pay, and health benefits. But St. Vincent hospital leaders say the union is purposely delaying negotiations, and they claim that's only hurting nurses in the end.
Do I want to ensure that the nurses who work at St. Vincent's are given a competitive salary? Absolutely. And that's the reason that I'm just really, pushing to get ONA back to the table.
St. Vincent Chief Executive Jennifer Burrows says talks have stalled, and not for lack of effort on the hospital's part, telling Fox 12 that the union has only met with St. Vincent hospital administrators once since the nursing contract expired at the end of January. Burrows says the hospital is offering nurses an immediate 9.3% wage increase, with smaller incremental increases over the next 2 years.
We feel like it's important for us to work through the couple of other places that we don't have alignment so that our nurses can start seeing this increase in their paycheck.
Burrows says staffing challenges do exist, but told Fox 12 that hospital leaders work hard and pay more to minimize the impacts.
The things we've put in place in terms of travel nurses and incentives for extra shifts allow us to have the right number of nurses caring for our patients. And so I want the public to feel safe coming here.
Hospital leaders at Providence St. Vincent also want to highlight that the hospital here has been honored for the past 5 years with a special achievement. It's recognized as a magnet hospital by a national nursing organization, and that designation is only given to about 8% of hospitals. Meanwhile, the Oregon Nurses Association and Providence St. Vincent here are expected to meet again at the bargaining table on Thursday. Reporting live tonight, KANDRA Kent, Fox 12 Oregon.
All right, KANDRA, thank you.